lifting quarantine lockdowns over the next few months. But, you know, Harvard researchers are publishing, you know, their findings saying that we might be social distancing until 2022, excuse me.
Yeah.
You know, with that said, you know, what do we need to tell people in specifically at-risk communities what they should do in the next coming months if these quarantine bans are going to be lifted?
Yeah, so the thing is that, just like you were saying, these quarantine bans are going to last all the way till May. And one state's or one area's quarantine is length is going to be much different than others, right? The cases of coronavirus and how severely it's affecting communities in New York is different from if you go to Idaho or Nebraska, right? Or other states that are thinking about lifting up the restrictions. And so, to be honest, I wouldn't be surprised. I know people don't want to hear this. I wouldn't be surprised if the length of quarantine in New York, especially, lasts a bit longer, past May. The real problem is about 4 different things that really affects the transmissibility of the disease in and of itself. First is what's going to happen when the weather gets warm. Right? Will the summertime actually stop the spread of the virus or kill the virus out there? Kind of like it does with influenza. That's a little more seasonal, A, because of the weather, and B, because when you're indoors, everyone's a lot closer to one another, and it's easily to transmit from one person to another. The second thing we have to be concerned about is if there's immunity, because right now we're not sure how long, if it does happen, how long the immunity lasts for. It could be a month, could be a year, based on influenza and other coronaviruses. It's probably around a few months, but no one really knows for sure. Thirdly is really something we control in terms of how fast we'll be able to make a vaccine and how fast, if needed, we can make more ICU beds and more critical care beds. Those are really the 4 big things I get concerned about that will dictate how soon we can lift quarantine restrictions and how long. What I think is probably going to happen is that these quarantine restrictions will probably be up and down, kind of ebb and flow over time. We're going to release the quarantine restrictions. The disease and the severity might come back, probably not as bad as it is during the first wave, but then we'll come back, and then we'll go back to quarantine and vice versa for a little while longer. So in minority communities, you definitely continue. That doesn't mean you have to stop wearing masks when you go out. That doesn't mean you go out and party, because don't get me wrong, I'm just hyped about getting ready, trying to party, hopping on my first flight to New York or Miami, trying to get it in. But that's a no-go for now. You have to be careful.
Not for right now. Okay.
You have to be careful for that. So that's something really to be aware of. Don't go right out. It's going to be a problem, and you still have to continue some of those thought processes that you had before, right? Don't try to avoid mass gatherings. Continue washing your hands. Continue wearing gloves, because it's not going to be an off and on switch just like that. The disease will continue to circulate in the population, and I think it'll be one of those diseases that will stay with us for the long term.
Okay, important information. Thank you, Dr. Cooper. I would love to hear what Tatiana thinks about that, especially working in Brooklyn on the front line. Later, sir.
Of course.
Appreciate the information, man.
Right. Appreciate you, brother. Hold on. Let me pin this comment on here, because I know people have been saying to actually get connected to the donations. Once again, we're saying we're actually raising funds for Brooklyn Hospital to get PPE. So if you could give 5 cents, 10 cents, dollar, anything you can, it would really be appreciated. You feel me? So let me actually pin here on here, because the link is on STOOP55, the STOOP55 bio. All right. And then we'll bring in, this is not working. Okay, all right. Pin my comment. Dope. You got a pin there. Perfect. Dealing with this technology slowly but surely. But now, let's bring in one of my good friends, Tatiana Dupuis. A good friend of mine, has worked with me the entire time when I was in New York. Tati, do me a favor, send over that message to get you connected. All right, let's get you in the building.
Oh, hey.
What's up? How you
So first
doing?
you're gonna put some respect on my last name.
Please, please, please.
That's
How
what
did you
you're gonna
pronounce your
do.
full name? How it's supposed to be said?
Yes. Hi guys, my name is Tatiana Duplessis. I am
Oh,
part
I'm
of the
terrible.
New York City Emergency Department.
Sure. Thanks for coming here. We already appreciate all your help you've been doing in Manhattan, around the city, and we would love to get a different perspective of what's going on, especially from the nursing standpoint. I've kind of given a bit of the emergency medicine doctor, but as nurses, you guys are right next to the patient. You're continuously exposing yourself. You're continuously right next to their hands, talking to their family. So can you give a little bit about what your experience has been and what's been going on?
So as I said, I work in a New York City Emergency Department. It was the like February, I would say. We just got a bunch of like worried well people. People coming in saying, oh, well, my neighbor is a UPS driver and I think he might have been exposed. That's what I was getting in my emergency department. We were Where I work, there's a lot of travelers. So initially we were only screening people that were coming from the hot zone. So it wasn't that serious for us. And then we started to get our positive cases, and then it got real. It's scary. Like nobody really knows how to deal with this. Every day things change. So one day you'll go in the emergency department and you'll be told something. Next day, completely different.
Yeah.
And it's scary because we're working and we don't know what we're bringing back home. We don't know if we might get anything. So it's scary, definitely scary on the front lines from the nursing side, especially since we're constantly going in and out of the rooms. We're doing procedures that can predispose us to getting the disease, like checking their swab or giving them a treatment. Those are the things that will likely give us COVID, and we're doing that
Yeah.
constantly. So it's a little scary to say the least.
Yeah, I can see that. How has it evolved? Because there's a lot of stories in my emergency department personally. Some of the volumes of new coronavirus patients have been going down. The hospital is still packed. There's still people on ventilators. I think right now my hospital is over 80, 90 people on ventilators, right? How's it looking now in your emergency rooms that you've been working in?
My emergency room, the volume has definitely gone down. Also, there's a lot, we've been very reactive with a lot of things. Thankfully, now there's different. So now we have tents outside of our emergency departments that keep the walking outside. You have urgent care and other places, and that are, places that are doing testing. So that has helped kind of diminish the amount of people we've been getting in the emergency department. People are staying home. But I work in Midtown Manhattan, so I don't know if the same is said like Brooklyn. I don't know if Brownsville has the same volume as myself. So, but right now the volume is definitely lower.
I see that. And you kind of touched on other places, right, outside of Manhattan. So, how is it from your knowledge and the people you know, or even your community? Because where are you from originally? You're from Brooklyn, correct?
Brooklyn, Flatbush.
Okay, okay, okay,
Yep,
okay,
Flatbush.
okay, okay. How is it, how to the people that you know, how is it different at the hospital you work at in Manhattan versus the hospitals in Brooklyn?
So for definitely different. The hospitals in Manhattan, my hospitals, as I said, is in Midtown. Brooklyn, I mean, everyone's staying home. A lot of people don't really live in Manhattan. People that are in Manhattan, they have better access to certain things that people in Brooklyn don't have access to. Also, where I live in Flatbush, a lot of people tend to go to the emergency room because either they don't have insurance or they can't get an appointment to their primary care physician. So they're like, you know what, I'm just going to go to the emergency room. Whereas people in Manhattan kind of know, well, there's urgent care or have better access to healthcare. So I live near Kings County and downstate, and their ER is popping. Whereas